Hello and welcome to Find Your Voice, where we interview thought leaders from our community at Podcast Guesting Pro. I'm Cassandra Welford, and today I have the pleasure of speaking with Dr. James Goolnik. James is a London-based dentist, a holistic health advocate, and a #1 bestselling author who helps people to understand the powerful connection between the mouth, diet, and whole body health. He is the founder of Optimal Dental Health in London, where dentistry is integrated with prevention-led care. His core message is simple: oral health is not separate from the rest of the body. James, welcome to the show.
Thanks, Cassie. Thanks for inviting me. I'm very excited to be here.
Well, we're really excited to be working with you and sharing your message. So I would love to know, after years of traditional dentistry, what reoccurring patient problem made you realise that dentistry needed to look beyond the drilling and the filling and the repairing of teeth?
Yes, great question. I was in the same practice for 25 years, and it was really sort of empowering to see my patients grow up, and they're changing in lifestyle, they're changing in sort of diet, and their mouth health has changed over that period, and watching them change and realizing that actually at dental school we're taught to drill and fill holes. Basically, we're told people don't eat sugar, don't snack, and then when they have gum disease, tell them to brush better and floss. And everyone knows those messages, but most people struggle with them, or they're really great and they sort of floss for 3 or 4 days before the appointment, and maybe a week or 10 days after the appointment, and then they forget afterwards. And realizing that actually, as dental care professionals, we have a lot more control over our patients' sort of whole body health rather than just their teeth and their gums. So realizing that we could change things, and the conversations that we have in the surgery, but also the follow-up, and the fact that I see my patients relatively regularly every 6 to 12 months, and I have the opportunity to get a benchmark of where they are now and actually set sort of parameters and tasks and targets for them, and I'm their sort of coach and their sort of guru to help them assimilate and make changes. And it's been really fascinating to see that, and having 3 kids myself, realizing the sort of the damage sugar makes, and getting frustrated by the fact that somebody comes back and we do a filling, and then they come back in a year and they've got another cavity and we do another filling, and it's like, okay, there must be a better way to this. And that's why I started to research nutrition, and realizing that actually you can reverse most disease in the mouth, tooth decay, gum disease, by really simple things, but sort of empowering my patients to do that, and then realizing what is important in them. So actually, what is the one sort of marker that will make a big difference in their life? And for some people it's really simple, like they haven't had their vitamin D checked for ever, and we do a vitamin D test and find it's really low, and we optimize their vitamin D through diet, lifestyle, and maybe some supplements, and then realizing that actually next time I see them their gum health is so much better, but actually they're getting less coughs and colds and diseases, because vitamin D is actually a hormone which helps immune health as well. So realizing there's a lot of connections with that, and having patients that as they get older, they go to their GPs and they sort of become pre-diabetic, and then they carry on having the same diet as normal, and then they get diabetes, and then they're put on metformin or various other medications, and realizing that actually there is a better solution than just giving medication to people, and sort of making them understand how their blood glucose works. And we do things like continuous glucose monitors and things with little devices that go on the back of your arm, and it monitors your blood glucose. So we can actually then show somebody that actually when you had your breakfast this morning, this is what happened to it. But if you change it slightly, maybe add some protein to it, or reduce the sort of fruit, it doesn't spike as much, and also you're going to feel better, you're going to have more energy, and guess what? You're not going to have tooth decay. So realizing those connections has been really empowering for me and for my team, and also so it's really satisfying because we can see our patients getting better, and also having less tooth decay, less gum disease, better breath, more energy, and most of the things that we help them with, it's free. It's just helping them, empower them to see what is important in their life and what will work for them and what is realistic. Because there's no point telling everyone to floss twice a day and they're not going to do it. They need to have a reason for it.
Wow, such a different approach to dentistry. Thank you so much for giving us such an insightful look into how you are different. And a lot of your patients are interested in longevity. And
Yes.
what would you say people are who are interested in longevity? They track their sleep, they track their supplements, they track their exercise. So why do you feel that the mouth is being left out of the health optimization conversation?
Yeah, well, the mouth, a lot of people know about gut health and since Zoe and all this sort of gut microbiome and all that. But realizing actually the mouth is the entryway to the gut. It is the second largest microbiome. It's very diverse, and small changes in the mouth make big changes elsewhere. And a lot of our vitamins and nutrients, if you're slightly deficient, rather than actually just giving somebody a supplement, you might say, well, actually, why are you deficient? And we do a microbiome test and look at the bugs in the mouth and realizing they're really low on one of the bacteria that helps produce, for example, vitamin B12 or something else like that. So actually realizing that we can give you some probiotics that can rebalance the bacteria in the mouth, and actually therefore you don't need the supplement. So it's actually sort of trying to look at a bit more of a root cause, what's going on, and optimizing everything, because there's a correlation between mouth health and lots of things like diabetes we talked about. We haven't talked about cognitive health and brain health and Alzheimer's. And there's a real correlation between that. So we get some patients who have sort of family members who've got Alzheimer's or early cognitive decline, and they're worried about it. They come to see us, and actually the three drivers in the mouth that can make a big difference to whether you're going to get that in later life is gum disease, so bleeding gums. There's a correlation between actually if you've got bleeding gums, which we call leaky gums, bacteria from the mouth can go straight into the bloodstream, get into the heart, get into the digestive system, and start causing inflammatory changes. So if we can seal up the gums, get the gums healthy again, stop them bleeding, that will reduce one of the markers. The other risk factor is having metals in the mouth. So some people are worried about mercury or amalgam fillings, and there's a correlation between that and also early cognitive decline. So can I look at your metal fillings, see if they're leaking or not? Can we safely remove them, called a SMART technique, to work on that? And the final one is sleep apnea and sleep issues, because people do track their sleep. They've got sort of Oura rings and Whoop bands and Apple watches and things like that. But what do you do with the data? We can help correlate the data for you and actually look and say, well, actually, you're showing signs of sleep apnea, which is signs where at night you don't get as much oxygen when you're sleeping. So ideally, you're sort of getting 95% plus oxygen at night. So your brain is sort of being oxygenated. Everything, all the processes in your body are regenerating better, and you're getting sort of reducing all the toxins and all the waste products that happen during the day. And that happens all at night when you're asleep. And if you're not sleeping well enough or deep enough or getting enough oxygen, these processes back up and they don't detox as well. And then you find that actually there's issues with cognition, memory, and function throughout that day. And then you tend to make worse food choices. So if you haven't slept so well, you tend to eat sort of carbs, full of sugar things as well. You just grab something quick and you don't actually think about what is nourishing your body. So we look at these sleep tests and say, well, actually, there's signs of early sleep apnea. And for some people, it's just about losing some weight. Other people, it's about doing what we call myofunctional therapy, which is basically like going to the personal trainer for your jaw. We show you exercises and techniques that you can strengthen your tongue and your jaw muscles. So it actually strengthens everything when you sleep. And then other people, we make these devices that you wear to actually stop your tongue dropping back when you sleep. It's called a mandibular advancement device. So it's a little mouth guard that you wear at night, and it makes sure the tongue doesn't drop back. Therefore, the oxygen stays all the way through the night, much higher, 95%. And you basically wake up much more refreshed and have loads more energy. So when we see my patients, one of the first questions I ask is about their sleep and how refreshing it is. I don't care whether they have 4 hours or 24 hours. I want to know that they feel refreshed in the morning. And is there things that we can tweak? Is it magnesium deficiency? Are there other little things that we can tweak to make sure they sleep better and they're fully refreshed for the morning? And I think that's the thing that conventional dentistry doesn't really look at. It looks at just fixing problems. We're looking at looking at your tongue. I can tell you whether you've got a vitamin deficiency. I can look at mouth ulcers. Okay, what's going on with your immune system? Okay, these are the different things that we can work on. So I'm more of a detective looking at the whole mouth, but then using those information to look at your symptoms and your history and your diet and your lifestyle and seeing how we can tweak things very simply to actually give you a better health span.
Wow, there's so much. And I think with sleep, so many people just accept bad sleep.
Yeah.
And I love that you're empowering your patients to not accept bad sleep, because as you rightly said, it impacts so many different areas of our life in just everyday living, but on top of that, the health challenges that can relate to, and how much you can actually do to help that with no pain. It
Yeah,
sounds
no
incredible.
pain, and also it's very quick as well. So a lot of things, when you change somebody's diet, I can see a change in their mouth within 3 to 4 months. So these are quick changes that you can see, and actually then go, okay, well, this is working for you, and let's, for example, for some patients, we reduce the number of times they're snacking during the day. So we say, like, okay, let's give you a really high protein breakfast. Let's see if we can extend the time between breakfast and lunch, have a bigger lunch, and then make sure you're stopping eating sort of 3 to 4 hours before you go to bed. Therefore, you'll find that you're going to sleep a lot better because your body's not trying to process all the food you've just eaten. A little tweaks like that we can do just to make you feel better and sleep better. So it's actually, we want the information about your sleep. We want to know about your sort of hydration and how much water you're having and when you're having it as well. Looking at sort of sleep patterns and when you go to bed, and seeing if we can help with the sleep hygiene slightly as well, because that helps us. If somebody's not sleeping so well, they tend to get more gum issues, they tend to bleed more frequently, and also our treatment is not as successful. So therefore, can we do these little things to make an improvement in your life? And it works really, really well.
Wow, I think you almost tuned into my next question there. What are some of the early signs in the mouth that might suggest someone is under more stress or heading towards a wider health issue?
Wow. Okay. There's quite a lot of them. So when we first see somebody, we have a sort of a 15-point health check, and we go through a whole sort of series of questions and signs and symptoms. But first thing we do is actually, apart from sort of asking all the questions, but we look at the pH of your saliva. So we're looking at your spit, and is it neutral? And do you have quite an acidic saliva, or is it slightly alkaline? And that helps us with, some people have silent reflux or heartburn, acid indigestion, things like that, and that will affect the teeth, not only becoming more sensitive, but thinner and going yellow and grey colour. So we can have a look at that and say, well, actually, there's something going on here with the pH. Then we would speak to your GP and maybe look at, maybe stomach acid is an issue here, and maybe some medication you're taking is affecting it. So we look at the sort of the saliva and how it works and how it neutralizes the acid in the mouth and reduces sort of tooth decay and obviously gum disease as well. We look at bad breath as well, because that's a sign of maybe bacterial imbalance. It could again be acid indigestion, and looking at GI issues as well. We're looking at obviously sleep and how they're feeling in the morning. We're looking at timing of nutrition. Are they are they gluten-free? Are they vegan? Are they vegetarian? We're looking at sort of blood markers. We actually do testing in the clinic as well. So we do finger prick testing, looking at vitamin D, which is one of the sort of critical ones for oral health, and about 80% of the UK is under vitamin D levels. So we actually look at how we can boost that. And then we look at a thing called CRP, which looks at level of inflammation in the body, and a thing called HbA1c, which is a blood marker looking at your blood glucose control in the last 3 to 4 months. So it just shows me how your body is responding to food. So they're things that we work on quite easily. We look at obviously colour of the mouth. We look at seeing your muscles and seeing how relaxed they are. And we're finding a lot of people, especially at the moment with a lot of stress going on, tend to clench and grind their teeth, especially at night time. Which means they're more likely to break teeth, but also they're going to have sensitive teeth as well. But they're also going to have sort of scars in the side of their cheek from biting their cheek as well. And sometimes their partner's sort of not very happy with them because they're making noise in the night and it stops them sleeping as well. So that affects their sleep. So can we make them a mouth guard, or can we look at why they're clenching and grinding? And for some patients, it's actually a mineral imbalance. The most common ones are iron deficiency and B12 can actually make the muscles a little bit more excitable. So we would look at that as well. So there's loads of sort of detective work that we do to see what is going on that could be potential issues. And a big one is inflammation and bleeding score. So we actually look around the gums and we do a percentage of the gum is actually bleeding, and we try and get people as low as possible. But depending on how much bleeding there is in the gums and where it is from, we then will say, okay, this is an issue, and we want to find out what's going on. Is it something specifically in the mouth, or is it a sign of something else going on everywhere else? And sometimes we get inflammation in the mouth shows up first before you get leaky gut and various other digestive issues as well. So we're looking at that as a detective. So it's trying to listen to you, find out what the history is, find out what has been happening in your life, maybe any medications, any supplements you're possibly taking now, and why you're taking them. Because some people just take them because they saw a podcast and thought, okay, I'm going to take this. And it's like, okay, well, for us, it's test, not guess. So I don't want to give somebody vitamin D until I know what level they are at the moment. And then once we've sort of maybe supplemented them for 3 to 4 months, we're going to retest them again and see, are you absorbing it? Because first of all, it might not be the right type of vitamin D that's working for you. A spray might be better than a tablet. And then if you're not absorbing it, could you have a genetic variation which stops you breaking down vitamin D, and therefore do you need injections? So it's actually looking at what is working, because it's not the same for everybody.
That's fascinating. I like that you use the word detective, because let's say you're doing so much to make sure that your patients are getting the right treatment for the right challenge that is apparent.
Yeah.
And just, it's fascinating. Thank you for sharing everything so far. You've written about sugar and
Yeah.
taste buds. How
Yeah.
quickly can someone start to change their relationship with sugar, and what happens to their taste buds when they begin to reboot?
Yes. So I've written a cookbook called Kick Sugar 5 years ago, and it was all about changing people's taste buds and how we can actually enjoy our food as well. Because the really important bit is no point eating the right things, doing everything right, but really not enjoying your life and not enjoying food. So for me, number one thing is you've got to enjoy your food and really be excited by your meals, but they also have to nourish you and give you energy for the day and what you're going to do. And I work on a sort of an 80-20 rule. So 80% of the time I'm eating things and drinking things that work for my body and are great. And then 20% of the time I'm having cake, I'm having birthday cake, I'm having whatever, the celebration or thing that happens. And I know I'm having that and it's fine. So I think that's the big thing for listeners to sort of realize that, okay, you're never going to be 100% clean and have everything perfect for you. There's going to be times when things happen and you're going out to a restaurant and you can't have the things you normally eat. So I think, first of all, giving you the permission to do that. And when I originally looked at trying to help my patients sort of change diet a bit more, it's like, okay, how can we make it easy for them? So found a paper that showed that actually after 10 days of reducing processed food and sugar, your taste buds reboot and change. So what happens is our taste buds are constantly turning over and developing, and new ones are happening. But on average, it takes about 10 days for the majority to change, to make a difference to your taste. So if you're somebody that has a lot of processed foods and sugar and things like that, if you can get through that 10 days period of reducing it, once you then have something sweet afterwards, it tastes so much sweeter. So you can actually repopulate them. So it's we did this cookbook called Kick Sugar with a chef, a recipe expert, and nutritionist as well, and looking at 2 weeks worth of breakfasts, lunches, and dinners. So they're all high protein, high fat, low sugar, no processed food, all cooking from scratch, all delicious different recipes, but things that you could make at home very simply. And actually, when you get past that 10, 12 day period, you'll notice your taste buds are so much different. And you can there's lots of different tips in the book, where things like cinnamon you can use on things if you want that sweet tooth, sweet taste, but you can use other more natural things that don't spike your blood glucose as much as sugar does. And also it shows you how sugar is processed through your body, and the fact that honey is the same as white sugar makes no difference. All these organic names and things like that, your body processes it the same way. So how does it work? What's the relationship with it? And then also gives you loads of tips of oral hygiene tips as well. And you can get it from Amazon, you can get it from our practice as well. But it's really, I really enjoyed the process of writing the book, but also it's helped so many people actually look at their relationship with food and actually realize that actually at 3 o'clock in the afternoon when they're having their sticky bun or something, it's actually not because they're hungry, it's usually because they're bored. And actually, if we can break that habit and say, well, at 3 o'clock, when I feel like I'm going to reach for that sticky bun, I'm going to get off my desk, I'm going to go for a walk around the block, or go into the park, or I'm going to ring my friend, or do something different, and see if that makes a difference, or a glass of water, and I still want the sticky bun. Probably not afterwards, and realizing how we have that relationship with food over the years, and we sort of have to sort of slowly tweak things back again.
Thank you for sharing. Wow, 10 days is not actually that long, is it, when you think about it? It might feel
You,
like it on day 7, but
I think if you plan it first, you sort of become accountable and tell your friends and family you're going to do it. You do a thing called a sweeper, which we go through the sort of the office drawers and the kitchen and the car and get rid of all the snacks and things.
The
And
car, especially the
yeah,
car.
switch them with something healthier that you enjoy, like nuts or sort of seeds or sort of yogurt, hummus, vegetables, things like that. There's loads of things you can switch for, or you can actually, for some people, it's maybe it's chocolate they have, and they're going from the sort of the Cadbury's or the sort of high sugar content. They've got maybe 50 grams per 100 grams of sugar, and actually saying, well, let's go to the supermarket, let's buy one with 30 grams per 100 grams of sugar. So that's a little switch. I'm still having my chocolate, I'm still having the sweet taste, but it's just dropped slightly. Do that for a couple of weeks, then you go from the 30 to 20. Do that for a couple of weeks, still having the chocolate. And I now take sugar. My chocolate has got 7.8 grams per 100 grams of sugar. So it's a 90% cocoa chocolate from Lindt, and actually it works really well for me. So I still get the sweet taste, I still get the chocolate taste, but actually I only need to have one or two squares of it, because that gives me the same sort of hit as I was having with a bigger chocolate bar. So actually you can make these changes quite easily, but it's just understanding how to read the labels, what's most important in the labels, and how you can sort of educate yourself better, but also feel better afterwards.
Amazing. I really like that you still have sweet treats, and
Yes.
I like that you shared the 80-20 rule as well, because I feel like people can see that it is manageable and you don't have to go completely without any treats. So thank you for sharing
No,
the
there
use
is
of
normal life. You can do lots of normal things and have lower dental bills, because most of my patients love seeing me, but they don't want me to do any drilling or any filling. They want the cosmetic stuff, the whitening, the straightening, things for weddings, things like that, and just making sure they're healthy, and also spotting when things are going off. So I can say, well, actually, something's going on here. What's happened? And then realizing they're going through a divorce or there's some stress, and I can see it in their jaw muscles and things like that, and how we can manage that together. So I think that's really important. So going to the dentist or the hygienist regularly just to check for mouth cancer, and just having somebody that can help clean and polish your teeth, but also help you realize when things are going off on the rest of your body, and how we can sort of get you back on the right track without
Amazing.
affecting the rest of your body.
Yeah, amazing. So if any of our listeners would like to have an empowering, holistic dental experience, you have a practice in London, but as I understand, people travel across the country to come to your
All over the
practice.
world to come see us, yes.
All
So
over
it's
the
called
world. So
all over the world.
how can they contact you,
So it's
James?
called Optimal Dental Health. You can find us on Google, you can find us on LinkedIn, Instagram, all the usual places. If you want to, the website is www.optimaldentalhealth.co.uk. Send us a message or find us on one of the social channels. We have loads of free guides to gum health, nutrition, things like that. So if you want to log on, sign up to the newsletter. We have a monthly newsletter that has really good tips and tricks on all the mouth health, but also the latest research and evidence-based, because we are not a woo-woo dentist. It's all evidence-based. We're all fluoride-free, metal-free, and looking at ways that we can help you get a healthier mouth and also longer health span.
Amazing. Well, thank you so much for your time today. We will add all your links below this episode, and we're really looking forward to working with you on your thought leadership journey, and wish you all the best with your continued success. So thank you.
Thanks, Cassie. Thanks a lot.
And thank you for listening.